your new administration. Cindy Sturger, you just met her, a lot of you did. Larry Putnam just came in, interim CEOs. Larry's got the hospital. Cindy's got the health center. I brought the cookies. So there we go.
And got the door unlocked.
I don't know, Don Bauer got it for us. Thank you.
Well, first of all, I have been able to visit with a little bit with some of you before we started. Thank you for coming out tonight. It's always nice to have time to visit with people from the community. We'd like to do it more. This is our first time to have an opportunity to visit with you and just open it up to questions. We're just going to take a few minutes to introduce ourselves, and then really the floor is yours, and we're going to be as forthright as we can.
All right, sorry I was a few minutes late. I sat down at the apartment over there and the time got away from me.
We're
Trying to get over here. Yeah, Cindy and I have been putting in long days. We certainly have as interim CEOs. She on the clinic side, me on the hospital side. But, well, I'm Larry. For those of you who have been here before and heard my spiel before, you're probably sick of it, Kirsten and some of the others. You know that I'm an old Montan, no hair left much. Been hanging around healthcare for a long time. I spent 14 years up in Malta, Montana. If you know where Malta is, it's up on the High Line, little town, Class B town, a little bit bigger than Superior, but not too much. Up there for 14 years as the CEO at the hospital. Tried to retire 6 years ago. Very unsuccessful with that effort. This is my fifth. I keep saying sixth. Maybe it just seems that way. You know. My fifth interim, temporary hospital assignment in the last 6 years. The Superior is. I've done them in Jordan, Montana, Lovell, Wyoming, Big Timber, and Livingston, Montana before I came here to Superior less than a month ago, just a month ago. We've been talking, in Alberton today, we talked about definitely being separate organizations. The clinic is very definitely separate from the hospital. But yet we work hand in glove together. Cindy and I meet every day. You can't have health care in a hospital without primary care providers and primary care services, clinic services. So we do work hand in glove together, to make, move healthcare forward, certainly in the county. I guess with regards to the hospital side, certainly we have a really good crew here. I've been very impressed with the leadership team, the physicians, the mid-levels, the medical providers. And before I even accepted the assignment, I was comfortable with the medical staff and with the leadership team here and the employees. You have to have those things kind of all pulling together and on the same page in order to be successful in healthcare. And you're real fortunate to have that here in Superior. And certainly the board has been a very positive experience the 3.5 weeks that I've been around. The board is very committed to making sure healthcare stays in the community for a long time to come and moving it forward into the future. It's no secret we've certainly had some cash flow issues, some budget issues. We've been working very hard on those issues. It's just going to take some time, and really Cindy will talk about that in a minute here, but it does take a little bit of time to come in and look at and figure out what's going on with the operation, with the cash, and the bottom line kind of for me is we're hemorrhaging cash at a rate of about $50,000 a month. We have a payables balance of about $550,000 a month. That was headed in the wrong direction. The last 3 weeks, actually, we made a little progress. Today, I just ran some numbers, and just in the last 3 weeks, we paid that balance down a little bit, about $75,000. So, I think we're in the early stages of, kind of unraveling the budget and the financial situations on both the hospital and the clinic, and we're just real excited to be here. I live in the apartment right over below Dr. Pafford. He's up on top, and I'm down below in the little subterranean apartment down right across here from the from the ambulance barn. I'm not supposed to say that. Where's KT? Is she in here?
She's not.
Oh,
You're lucky.
Right. I heard that. I'm really not sat down and talked to her, but I'm not supposed to call it the ambulance barn. It's the ambulance facility. I'll remember to do that. But yeah. But every morning I try to get up. I try to get over here early. Cindy says I'm always earlier than she is, but it's not always the case. But when I do get up and when I get over here, when I step out of the apartment and when it's light, it's just absolutely incredible in Superior, Montana. And for an old Montanan, to get up, it's a real privilege to be here, to get up and walk out that door and see those tamaracks on the other side of the road. It's a pretty spectacular place. And be happy to answer questions and concerns that you might have, as we go through the meeting. Cindy.
I just want to recognize that the only reason both of us are here is that you had two boards of directors that did an outstanding job. As many of you know, either that were involved in it or read the newspapers, there was some leadership issues here, right, in the last year. And so your boards acted quicker than most boards would and took care of that issue quite quickly. As many of us know, there's probably a lot of incompetent leaders in the world, and some of them are still in leadership positions. And somehow, both of these boards were able to understand what was going on and to help take care of that in the best way that they could and the moment that they knew the information. And so there's two board members here. I just want to make sure that you know. John is on both of the boards. If you want to say hello.
I think everybody
Come on,
knows
say
me
and,
here.
and Lloyd is on both of the. Are you on both of the boards?
Yes.
Right. On both of the boards, you want to say anything?
Anytime you'd like to talk, I'm
Sorry, we have Jim Sabri. I'm sorry, he was an original board member on the clinic side as well. And so I do want
He's
to.
on the current now.
And the hospital, right. We
Right.
have dual, which is an unusual thing. Quite lovely to have, but it's an unusual thing to have board members that serve in two healthcare capacities. It's quite a statement to this community to do some of that, right? To have that collaboration.
I actually had that happen in Malta. When I was up in Malta, we had a separate board for our long-term care facility, our nursing home. We had 7-member boards on both sides, and 3 of those members crossed.
Yeah, it's a great model. And then I do want to recognize healthcare can't be delivered unless you have healthcare providers, right? And so we have 3 outstanding providers right here. Just want to recognize Dr. Pafford, who of course works in the clinic and of course works in the hospital, right? And Kirsten, who, as many of you know, no offense to Dr. Pafford, but nurses run healthcare. You need to know, as we all know, we don't have good nurses. So Kirsten runs the nursing over at the hospital, and Regina runs it here. And I have to tell you, both of us have been around a lot of nursing staff. These 2 are exceptional. It's one of the reasons when I met Dr. Pafford, who also is a musician, which is one of the reasons I said I would come here, because I hadn't really met a classical guitarist doctor before, and Regina, who is so solid as a nurse. So there's just really good staff that work here. So we came here, and it really feels like we came and there was a bundle of everything was really wrapped up in lots of vines, and we couldn't even see what the bundle was. So we're here just starting our 4th week, and the whole 3.5 weeks we've been here is about unwrapping those vines, getting them cleared so we can see what is here. So we haven't even gotten to the place of saying what needs to happen. We have a sense, but we're not going to jump to that, right? You've just had that experience in this community, right? A lot of jumping around, a lot of decisions being made. People didn't really know everything going on, and we're not going to do that. We're really unraveling that, as Larry talked about, and taking a look, and we're getting pretty close with our boards of saying, this is the state of the state right now. Larry gave you some implication of what's happening at the hospital. We have a similar trend going on at the clinic. It's been turning in the last 3 weeks, okay? But we have to get clear before we can say what's the plan. And we're just starting to get clear. And so we're going to share with you and any questions you have about what we know at this moment in time. lots of experts in this room. I've had the privilege of meeting some people that have been leaders in different facets here. So we're opening that up to you to ask us anything that you have on your mind or wonder about.
Fire away, fire away.
Are you getting the billing straightened out of from the clinic?
I am hoping to heaven I'm getting it
when
straightened out.
they are a year behind in billing,
So we are not anymore, just FYI. That is getting
and
straightened
then they
out.
bill you and you pay it, and then you still get another bill?
It's quite frightening, isn't it?
Yeah.
I'm with you, it's quite frightening. It's frightening.
I mean, how can you collect from Medicare or even our
You
supplements?
can't.
Some of them.
After a year, you
Can't.
can't.
Right,
Right.
you can't.
So you've lost it?
There, we have lost some. I mean, just straight up, yes, we've lost some. But we just went through the amount we lost on the clinic side. Now remember, we are a very small clinic, okay? You know, you live really close to Missoula, right? There are some big clinics in Missoula. We're very small, we live in a small populated county. So for us, it might sound like a small amount of money,
Oh, it's big.
but the percentage, right? So we're quite concerned that stops. That was the first thing we did the first week, both of us.
Do you need to
Stopping
give
our billing.
another new billing gal?
We will be, just FYI. That's in the plan, that Lloyd on the Finance Committee has seen the first stage of a proposal in our board's meeting Thursday to look at what might be the beginnings of a plan to make sure our billing stays up to standards that it should have been at.
And not being billed twice for the same.
Yes. So if you have been, I want to hear about that, and I would like your name and phone number so I can take care of that pronto.
What was the other one? Oh, what's the name? You've lost a lot of patients in Mineral County, a lot. They got so fed up with this, and I'm hearing it out in the public to my face, will never go back to this hospital. Never. You've lost them to Sanders County and you've lost them to Missoula. How are you ever going to get the trust of the Mineral County residents again?
So,
You get doctors and they fire them.
well, you know better than I do, right? Patient care is the number one reason people come back. So what we have to do is give people an extremely positive, accessible, not double billing them the bills experience. When that happens, people will come back. We have to change how we deliver care. We have to do it the right way, and we have to do it when people need it and give them what they need at a quality standard, right? So that's what we have to do. That's our mission. That's
I'm
what we're
talking
supposed to
of
be
personal experiences. I've
Right.
had personal experiences in the emergency room and in the lab here. It's not even sanitary. Why don't you get to see MD or a DO in the emergency room? All you get are PAs, and there are some I do not want.
So I would encourage you to make sure you talk to us individually about that, about your specific experience.
I
It
have.
sounds like, yeah,
I have.
perfect.
How did,
So I'm gonna let
how did
Larry-
we do on rectifying it, Shirley?
Yeah.
How did we do?
I'm not good. You were excellent.
You
But
will
I'm
not,
not getting itemized bills, and there are errors.
well,
I am with you on billing. We are doing our darndest.
When will that come into play?
We're doing it every day.
Itemized
Every
billing.
day.
I go down here every 3 months to the hospital and to the clinic, every 3 months. I've had some bad experiences.
you know, back to the PA question, you will not get PAs, or I mean, excuse me, MDs and DOs in the ER. You will not get MDs in the ER in any community of this size in Montana. You know, Terry and Ecolak and Circle and Sheridan, Montana, they run on PAs. You know, they run the ERs on PAs. And they're just as qualified as MDs or DOs.
Some of them aren't here. They need to go back. to
Some may,
school.
or, you know, those are personal choice issues. They're personal choice issues, but you cannot afford in Superior, Montana to staff your ER with MDs all of the time. I mean, it's just,
But when
it's
they-
impossible.
When they
It
get
is
doctors
impossible.
here, why do they up and fire them? I mean,
So
I know, we can't
I
answer
mean-
those questions. We weren't here at the time. when
I know
it
you
was
were, but I
occurring.
mean, they can still practice in other places, but they're not allowed to practice here. I mean,
So Shirley, here's what I need to tell you about your boards of directors and the staff here. Their concern is to make sure that you're safe. So somehow those boards and those staff learn something about these folks that they cannot make public. Because we live in America and we're a litigious society, right?
it's,
So every community I've worked in, and Larry has too, there are people who think exactly like you, that the doctor or the PA should not have been fired. And you know, we don't know if you're right or wrong. All we can say is at that point in time, you have incredibly competent board members and staff that are still here that said they did not feel it was safe in the capacity at that moment for those people to be serving the context, which is this community. That's all we can say. And then we move forward and everyone tries to make a better decision. And you have every right to complain about it. Because when we lose a doctor we really like, it breaks our heart.
Right.
I mean, this one doctor has most of the patients from here.
Sure.
And if they, you know, and he's still practicing, he has hospital, you know, and the other one, you know, I mean, I don't.
We feel your pain, and there's
Yeah.
nothing we can do about it.
Yeah, I will say that the community, you know, I've seen some other examples of this, that in other communities, these situations with physicians that have gone, you know, come and gone, and they're beloved in the community, and they're not there, you know, anymore.
They're next door.
Well, but they're not
No,
practicing
they're not.
at the hospital, they're not at the hospital or the clinic. But the community will hang on to that for, up in Malta, there were a couple of situations like that went back to the 1950s, okay? You gotta let it go. If you don't let it go, you won't have a hospital and a clinic. And that was our message this afternoon in Alberton. It's really important right now because of the cash flow situation and the issues that we're having. Maybe you don't like the ER and you don't like that service, or you don't like the primary care situation or something, but please come and use the long-term care facility and the assisted living facility and, you know, and those facilities. And the clinics, I mean, don't get me wrong. Use our facilities because that's really important to us right now. It's just really important to us right now. One or two patients in the long-term care side or the assisted living side. We had an admission, you know, over the weekend in the assisted living, which was really nice to see. That's a beautiful facility. It's very well run. You get much better service with the long-term care facility and the assisted living facility than you're going to get in Missoula or Plains or anywhere else. I mean, it is a very caring, personalized service. And also the surgery services that we're cranking up with Dr. McClellan. He's a real class guy, excellent physician, very high quality. Also Dr. Gardner, we're working with him. John has been working with Dr. Gardner. We're in the
Now, what is
process-
Dr. Gardner?